I actually have done a fair amount of all-on-fours as well as dentures. Just to give you an idea, if you don't know what an all-on-four is, it's usually 4 to 6 implants where an implant denture is placed on. So it's kind of like a fixed prosthesis. But one of the big problems we have is keeping those clean, right? And if this is something that even denture wearers or people who are at risk for chronic dry mouth or relief of dry mouth symptoms, is this something that you would definitely recommend to those type of patients?
Oh, for sure. In fact, my grandmother had Sjogren's syndrome in addition to rheumatoid, so she was not producing saliva. And
oh god,
yes, and the biofilm doesn't discriminate,
right?
And so they're located everywhere in the mouth surface, which means denture wearers still are prone to gum conditions and gum inflammation.
For sure.
And do need to think about protecting themselves against their own biofilm.
And it's probably obvious to me and you, but I have had a fair amount of patients that think once their teeth are out, it's over, because, I don't have to worry anymore. I've heard patients just say, okay, well, once we get these implants, I'm good, right, doc? And I have to remind them that, hey, you know what? The biofilm doesn't go away. And maybe you can touch on that and just say, even if you lose all your teeth, there's still biofilm present, correct?
Correct. Absolutely. The biofilm does not go away. For instance, by the time you're brushing your teeth, right? By the time you set your toothbrush down on your kitchen's or your bathroom sink, bacteria have already started to recolonize those surfaces. You did not change.
That's crazy.
You don't change their behavior. And so our approach we're really trying to change the way bacteria behave because we know they're going to set up a new home, right? That's what they want.
They just don't discriminate at all. They just don't care.
They don't. Right? It's a happy, warm, they get fed on a regular basis. It's a
good deal.
They're very happy.